hospitals based on the ships are starting to get full. So we're going to try to send them cases that can be done with, and many of these patients have x-rays, you can tell them that. Many of them have x-rays. So simple fractures that can be done without C-arm. So guess what? I'm going to treat this non-operatively. We just need to make sure she doesn't get sores underneath her heel.
Oui, il est cassé un peu, mais on en met 34. Okay? She was looking so bad yesterday. She's looking much better.
Hey guys, they need some Dakin solution to dress somebody out in the tent. We got a bottle or two around?
Here first, E-O-R for simple.
Some of them have been on CF.
No, it does look like it, or it doesn't look right. But that's a complex fracture, and I think it really does look like he might have a permanent fracture. We would again do more harm than good on him. We don't want to do that. I'm not gonna try to sell anybody a bill of goods. I want to make sure we can do what we can do for you.
Okay. No, that's good. I appreciate it. My name is Anil Menon. I'm an ER physician and a wilderness medicine trained ER physician who is at Stanford University now, and I'm also in the Air National Guard at the 173rd Fighter Wing. I was scheduled to do a month tour of duty there with the fighter pilots, taking care of them as a flight surgeon, and then this disaster happened. Bob Norris told me that day that he would like to send some physicians down. I called the colonel who leads our fighter wing, and he okayed it, and so that quickly we started the process to just get down here and just provide some care, and that was my major impetus to come down here, is just a willingness to help and the availability and time, thanks to the Air National Guard and Stanford, because I know that's part of their mission, so that's why I came down here. On a personal level, it's been traumatic. I've worked in Afghanistan, and I've seen soldiers hurt, which really strikes home and makes you feel really sad, but you're able to give them top-notch care. You can save people with 97% burns. Here, on the other hand, you've seen so many people that you feel like you could do so much more, but you're just overwhelmed with the numbers and underwhelmed by the lack of resources, and that's totally understandable given the way the situation happened. So it was a lot more emotionally hard, I feel. It was just a very traumatic thing for me. We certainly come in here with a certain American mindset that we want to get things done a certain way with a certain level of efficiency, hierarchy. That makes perfect sense to us. Here, of course, they operate under different circumstances and expectations, and I'm not making a value judgment on that at all, but I think it has been an issue in just finding agreement in that, and really that comes down to communication. So if I would say the top 3 rules that I learned, probably number 1 was to smile, number 2 was logistics, and number 3 was organization, and those 2 are worth more than any amount of doctors we could ever have. So the logistical chain of just getting things here, and then the organization, which comes to the multicultural aspect in terms of communicating. To people in the States that want to help, I would say that support to the people that are down here helps a lot. I know that this is just on a personal level. Getting the sort of support saying, you know, we appreciate what you're doing, and just that emotional support has really made this possible, because every day we're sort of working until the point that we fall down. So that helps. In terms of just material support, it helps to go through a well-established chain, a supply chain, something that's already set up, like Partners in Health, International Medical Corps, whichever it is that you can get to. They've sort of figured out some of the logistic problems down the way, what the roadblocks are, and they know what the needs are. And for people who want to do personnel support, again, those sort of groups are also helpful, because at certain times we've had more surgeons than we could use, and I knew a group in neurosurgeons that came down here, really smart, could be really helpful, but we didn't have the neurosurgical tools to utilize them, the operating space to utilize them, and so organizing with those groups that are already here is helpful. Very early on in the disaster, of course, just about anyone helps. And if you're going to come down here and help, you certainly need to be flexible, because at different times I was a nurse, a tech, transporter, anything, someone who's willing to work at night. You have to pretty much be willing to do anything. A good attitude is a lot better than a degree.